Okay, here we are. Now let's try this again. Here we are live from the Aired Out studio on Main Street in Barrie, directly across the street from our presenting sponsor, Nelson Ace Hardware, where they have lots of Father's Day gifts just waiting for you, just to come in and snatch those up. Lawnmowers, tools, grills, you name it. They have it over there and they can't wait to help you out. Have you been in yet to see
So
the
much
new
stuff.
patio furniture?
Yes.
Yep, I have to go in and check it out
Yeah.
a little more because I think I've decided I want one of those sectional couches for the deck.
Mm.
I think that sounds like a really good idea.
Yeah.
So-
Jason and the boys have been remodeling the sunroom for me. It's
it'd be perfect.
amazing.
Perfect.
All new paint, all new ceiling. They've been working for weeks on it. And I'm thinking for Father's Day, I should get them some new stuff from Nelson's to outfit
Right,
it.
right. It'll be
To
for them.
realize
Right.
Totally for them to realize.
Well, you want
my
them to have a-
vision in the room that they worked so hard to
Yeah,
remodel.
and you want them to have a place to sit and relax after they work so hard.
Yes,
I mean,
absolutely.
come on now.
You know, enjoy a nice cold, refreshing drink in their Yeti that'll stay cold for hours. That they also get at Nelson's. Absolutely. Yeah.
So, well, this afternoon we decided to jump back on here for a special episode so that we could get some information out there about Sunrise in Montpelier Sunrise Wellness Center.
Yes.
And so the dear Penny Martin has joined us. She is the Director of Recovery and Peer Services.
Correct.
That's a big umbrella, I'm
It
assuming.
is. Yeah, it's a
Yeah,
big
like-
umbrella, but a
yeah.
fun one.
Like one of the market umbrella sizes. Yeah.
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 Definitely.
A lot of stuff on your plate. And then, as we know, Heather Slayton, Director of Communication, Director of Imagination Station and Communications Coordinator for Washington County Mental Health. And as always, we're super glad to see you.
I'm always super glad to be here.
And you have a lot of information to share with us today because you've had a lot going on. You have a lot of new information out that we are trying to help you spread to the community as
Yeah.
hard and
We do have
loud
a lot of
and
stuff going on. Definitely.
much as we can. And then I know that you have tons of stuff going on. We got to visit your place last summer.
Yes.
I don't know if it was around this time or not. You were doing
Yes, it was.
the color run or the
Yes.
the chicken thing where you guys
Both.
were flinging the rubber chickens last
Both.
year.
Yeah, it was
Yeah.
a combination fundraiser.
So are you doing that again this year?
We are not.
You're not.
This year. No.
We try to mix up the fundraisers a little so they
Mhm.
don't get too monotonous and people will be excited to try the next big thing
Yeah,
with us.
yeah.
And so, but the purpose behind the fundraiser generally remains the same each year. It's
Yes.
always culminates in a big trip for
Mhm.
the folks that are down there taking part in the services available at Sunrise. So a trip that most people that are down there might never have the chance to go on otherwise.
Right.
And
Mhm.
can learn a lot from. And yeah, so it's a great thing to be doing, but it'll be a different fundraiser this year.
So is there a nutshell to explain what Sunrise is?
Well, Sunrise is pretty dynamic, so it's never the same 2 days in a row. We are open to anybody within Washington County Mental Health, and we also open our doors to the community as well. So we have a food shelf. We serve community meals. We are currently a site where people who are unhoused, if they need showers, can come on in and take a shower. We work on pre-employment skills, social skills, symptom management, cooking classes. We're providing, thanks to a grant, a CSA to families within the agency, so they'll get some fresh, organic vegetables as long as the grant runs. And so we do anything that needs to get done. We try to help out with. We also have a wellness program where participants get to meet with a nurse each week. maybe they're working on weight management, smoking cessation, diabetes control, nutrition.
So, like we said, a huge umbrella.
We do.
You work hard with the community at large to maybe get them the services that they need and to
Yes.
encourage them to take care of themselves.
Exactly. Yes.
And to augment the services they're getting. And there's also an exercise room.
Yeah.
They also have a sensory room of their own.
Oh,
That's
that-
right. Yes. We just got new bubble lights in today.
so in what is your sensory room called?
Well, it's very small, and we do want to change the name of it. We call it the quiet room right now.
Mm-hmm.
Where people, if they just need a break, can just step out of.
I could use a
the-
quiet room.
Come
Maybe
on
I'll
over.
swing down
So
this
could I.
afternoon. Maybe I'll swing down.
Come
That
on
sounds
over.
fabulous,
Yes.
actually. Yeah. And are you still doing now? When we were there, you were doing meals from all different parts of.
Yes. Yeah.
You were
We-
everywhere. I can't remember. I think you were doing Turkey when we were there. I think that's where you were when we were there, was Turkey.
So, yeah, we often do different countries. Now we actually have a system where we use the chickens from the fling, where you can just aim it at the map of the world.
Uh-huh.
And wherever it hits, if we haven't done it yet, we'll click from there. We are not consistent with every week doing it, but we still do that. It's a lot of
Which
fun.
is totally cool.
Yes.
And the day that we were there visiting, you had quite the crowd, actually, utilizing all different kinds of services. I think you had some people using the computer. Some people were cooking. Some people were volunteering, trying to help get things prepared and stuff for that meal that day. Now, do you serve those meals outside of the building, or do people just come to you?
They come to us.
Mm-hmm.
They come to us. Certain times a year, usually around Christmas and Thanksgiving, we will provide meals to families within the agency.
Mm-hmm.
We're not professional cooks, and we have a small kitchen, so
Right.
we do the best that we can, our family meals.
Well, it looks and smell great to me.
So we
Yeah.
average about 100 meals during those 2 holidays that we send out to people who wouldn't normally have a holiday meal.
Right.
Right. And that's a huge collaborative effort.
Yes,
Um,
throughout the
people
entire
come together and cook huge parts of it, and it all just comes together, and they are like an assembly line down there. People come down and help and
Mm-hmm.
package it all, and people can sign up ahead of time and let them know what the need is, and they have it all together and pack it out to them, and it's an amazing thing to witness.
It is an amazing. We, as you know, we did it here a few years in a
Yes.
row
Yep.
during COVID, and to the assembly line and all of the people that were willing to come together and do such a thing. It was just amazing.
Yeah.
And we had to take last year off because I had some stuff going on with my eye, but I want to start doing it again
Yeah.
because we did it on Christmas Eve, and it was pretty amazing.
Yeah, it's incredible to see how many different folks do that
Mhm.
anyway, but to watch them do it at sunrise on top of their typical programming day to day.
Right,
And to
right.
add this on top of that, it's just incredible to watch.
Yeah,
Yeah.
it's pretty awesome.
we have people volunteer to make pies. At Christmas time, we actually do Christmas cookies
Mhm.
or holiday cookies. And the feedback we've received is that that's the favorite part because they're things, those homemade holiday cookies are not the thing that most of our individuals get to have it each year that we take for granted.
Yeah,
Yeah.
the thing that really brings you back makes it feel like a holiday,
Right,
like to your
right.
childhood, like, oh,
Yeah.
the thing my grandma used to make.
And as we know, anything that Washington County Mental Health provides is for everyone. Everyone is welcome. It's literally a space where everyone can feel safe and welcome and like one family.
That is our
Really.
mission.
Yeah, I think you do a great job.
Thank you.
I think you do a great job.
Thank you.
And we're lucky that we have that here because not a lot of places do. And even though, as you and I have talked about before, with JD, staffing is an issue. It's an issue everywhere, and there are a lot of people. You have tons going on, and you provide so many services throughout the entire county of Washington County, but a little bit beyond too. Don't you do
The towns
some?
of Orange, Washington, and Williamson.
Yeah, as well. And so
Yeah.
that's a lot of people that you're trying to get those services to, and
Right.
it can be a struggle sometimes. There are wait lists. We've heard that right now there are wait lists. There are wait lists everywhere.
Right.
And at least know that if you've made contact, that somebody is going to be there, and you have a new program or something newer that you're kind of releasing right now, where you have some numbers, some contacts that people can reach out when they need help, and maybe you can tell us a little bit about that.
Oh, our help cards?
Yes.
Right. So the program isn't new. It's just that we are trying to make sure that everybody is fully aware.
Mm-hmm.
And so the help cards that are going out, and now we even got stickers, and the
Yes.
posters will be up. And so
We have some up here.
You do. And so these are the stickers that will be out. Oh, well,
Mm-hmm.
this is just a photocopy of it, but that's okay. So we've got the stickers and the help cards and the posters that will include the QR code of our survivor's guide,
Mm-hmm.
which are not always as easy to get a hold of because they get picked up so quickly.
Right.
But you can shoot it with your phone now. So the final printing finally got delivered to us this week, and so we are going to be out slamming the entire community with these. They'll be at businesses, doctors' offices, police station, in the hands of all first responders.
Now, do you still have a
libraries.
kiosk at the mall?
I think that's actually probably going to go away by the end of the month.
Uh-huh.
That was largely for HR purposes,
Mm-hmm.
and people, have kind of stopped really visiting that as much. So that probably is going to go away, but the information will be dropped off in all the businesses in the mall. So it should still be fully accessible,
Right. Right.
just not in that one central spot, but you'll be able to, assuming they're all very, very receptive to this, should be still accessible in every building instead of just in one spot. And so now that I've got the printed materials in my hot little hands, we're going to start beating that path through the entire county and in those 3 towns. So our contact information, should you be in crisis, know someone in crisis, or just need to reach out for services.
Right. Everything
It's
is
going to
there.
be everywhere. It will now be everywhere. So yeah, just definitely call us for anything, and we will do the absolute best we can. And I think it's really good to point out that not every service has a wait list.
Right.
I think that people, we have wait lists. Everybody has wait lists for something right now, and that's just the way the world is right now, unfortunately. And for many reasons. But
Oh, yeah.
not every service that we offer has a wait list. Some do. That also does not mean that you have to wait for everything just because you're on a wait list. If you're waiting maybe for a specialized one-on-one service, that doesn't mean that there isn't a group
That
version
isn't
of that
available
service
for
that
you.
could join. That doesn't mean that we can't point you in the direction of a community-based service that is similar to what you're looking for that you could take advantage of while you wait. That doesn't mean that we don't have like a free community-based thing of our own that you could take advantage of in the meantime. So that's why we create things like Wellness Wednesdays or the kids groups at Summer Street for people to just have a contact or to build networks with other people in similar situations.
Or maybe just go
So
have
that you
lunch
or
at
just
Sunrise.
go have
Over to
lunch at Sunrise.
Right.
Exactly.
So that you can have some contact, so that you can meet people in a similar situation, so you have anybody to connect with while you're waiting on those wait lists. So there,
Which is huge. And
Right.
Again, that's not something that you find
Right.
everywhere. We are very fortunate to
Right.
have, you all here, and to have those safe places and contacts and people that we can communicate with every day if we need to. There is somebody, there is a way to be somewhere,
There
or
is.
speak with somebody, or have
Right.
some involvement.
Well, and we're very fortunate to have the staff that we do have.
Yes.
So some of our staff are phenomenal at writing grants.
Mm-hmm.
And through those grants, we've been able to create programs like Wellness Wednesday, where we're also very, very blessed to have amazing community partners. Because if we didn't have the massage therapists, the acupuncturists, the people that do the mindfulness meditation, the naturopaths, the sound healers, if we didn't have those people in our community,
Right.
then what would we be using the grant for? But if
Right.
we didn't have the staff that could write the grant to pay for these things, we wouldn't have the activity at all. And so it all has to work together completely perfectly in order for any of this to work for the people that need the contact, or the people who are maybe not on a wait list but want to try to do something for themselves to stay well so they don't need the services at all. And so in order to do all of those things, we rely heavily on our community partners and on our staff who are writing these amazing grants.
Right. Right.
So people like Phil Wells, Maria DeHane, you know, we need that.
And that's a tough job.
And so
Writing those grants is
thankfully-
no easy task.
No,
It's
and-
nothing that I would
No.
ever want to
And then
even
the
try to
people who are
conquer.
giving us those grants, you know, and they're not massive. We, you know, some of these things don't have to be humongous grants. And like Penny got her grant for the CSA.
Right.
You know, you wrote a fabulous grant for that, and
Which is
you know, and
which
then-
is what? What is CSA?
So that grant's actually going to be covering two different areas. I've received 2 grants from the Vermont Food Bank, great organization. The first one is going to help us do what we're calling Cooking 101, where the goal is to teach people how to cook and with fresh vegetables and fruit. When you live on a limited income, buying fresh fruit and vegetables is extremely challenging. We all know how much groceries are nowadays. And so through the food bank, with one grant, we're able to do the coursework, and then with the other grant, we're able to buy fresh fruit and vegetables to introduce people to these food items that they may not be aware of, as well as how to use them to augment food that they can get from the food shelves, and just eating them on their own. So we're lucky we work with a garden in Montpelier, Ananda, and they provide us, you know, organic fruits and vegetables, and then we will take and we will use them in our meals. We'll provide them to people who have asked to be part of our CSA, and we'll also teach people how to cook with them.
Which is pretty awesome.
it is.
I mean, that's a great program. And are you there? Let's let people know how often you're all down there and open at Sunrise.
So we're Monday through Friday as it stands now. Monday, Wednesday, and Friday we're open from 8:30 to 12:30, and on Tuesdays and Thursdays from 8:30 to 2:30. And so yes, right now it's just Monday through Friday.
And we're getting a comment that says you do a great job.
Oh, thank you.
Yes.
Thank you.
Yeah, Mary Manning Haynes says you do a great job.
Thank
And
you.
so, now, do you see people from all over, or do you mostly see people from Montpelier area in your service?
So throughout Washington County, primarily Montpelier and Barre, we do provide transportation support to people to come into Sunrise, depending on which community
That was my
they're
next
in.
question, because we all know the busing service
Right.
lately has not been so great either. So that was another struggle that I'm sure that you had to
So we do provide some
conquer.
transportation support. Again, it depends on where you're located, but we try to help as much as we can, and so we'll bring people from their home in and then back home again.
Which is awesome.
Yep.
You too? Do you do transportation stuff for any of the programs down here?
It's just us.
You must.
Personally, no.
No.
It's just
Yeah.
Sunrise.
Yeah.
It's
Yep.
Sunrise. But we have a support team that is primarily peer-based that also will provide support to people who may have anxiety or mental health symptoms that make it challenging to use public transportation. And so we'll provide support getting to medical appointments, to education areas, grocery shopping, laundry, things like that. The support team is pretty amazing.
Nice.
So other programs, if that's what you're asking.
Yes.
Other programs, so Sunrise is part of our community support program
Right.
where they serve adults with mental health challenges and substance use disorder. And then you've got the CDS, which is Community Developmental Services. And those are folks with people with autism or intellectual developmental disabilities. They provide transportation support around, so the folks who have community supports would ride with their staff sometime, you know, around their like employment or entering the community, things like that. If you've got people in residentials that require rides to doctor's appointments or school-based stuff that requires transportation, those kind of programs would provide transportation support.
Okay. So I'm not sure if that answered your question or not, Jade, but so there are different programs within the city of Barry that, yes, do offer transportation if that service is
It's very specifically
very specific.
geared toward the program and the person.
So that was just one of the questions that came in. So
Yeah.
making sure. I know that I think she's talking about the building on Richardson Road.
Yep. That would be CDS.
So that is one of the
Yeah.
services that you do provide
It's
transportation
very
if it's
specifically geared
specific.
toward the person and the service they receive.
Yeah.
Yep.
So good. And what else are we going to share?
I
What do you ladies have going on?
Well, I think it's very good to talk about your peer-driven services.
We have a great peer
and
program.
stuff.
So Washington County has been employing peers for about 30 years. So long before it became popular.
Before even I worked here, which is shocking. To think back that far.
And we have, within the community support program, about 32% of the employees are peers.
Wow.
So that what that means is somebody who has lived experience in either substance or mental health. So maybe it's struggling with anxiety, maybe it's a history of alcohol use and abuse. The employees having those experiences and being able to work with people that also experience the same symptoms, there provides an extra level of hope. And so we're really proud of the fact that 32% of our employees are people with lived experience.
Wow.
And that's just the people who are self-identifying.
Right.
Right. Exactly.
Right.
It's probably much higher, but those are
Yeah.
the people who are saying so.
That right. So there's peer for us. There's a lot of different definitions of what a peer is, and for my purposes, it's a peer is someone who, as part of their job, may discuss their experience.
Yep.
So maybe I've had this experience at the hospital, or I had this experience with the police, or I've had this experience with my family, and so yeah, I understand. People who are under the general category of lived experience may not be required to disclose, but they may say things and they may have a level of empathy that
Someone else doesn't necessarily have.
somebody else may not have.
It brings a deeper meaning for the people that we serve to our, where hope and support come together, really.
Well,
You know,
That's huge for anybody that struggles with anything, even myself as a parent to an addict. Being able to talk to another mom or a dad that's going through the same stuff is huge, because it seems like a really lonely world a lot of
Right.
times, where you don't necessarily want somebody to know what's happening or something. You just don't. You don't want to talk about it, but you do want to talk about it.
Right.
And so knowing that there is somebody like that that you can reach out to, not just in that experience, but any experience, the anything that you're going through in life, just to know that you're not by yourself is huge. And I would think even for the people that are the peer support people, it's a give situation, because
Absolutely.
you both learn from each other. You're supporting each other, and that may be their title, but I'm just assuming that they're gaining a lot from their own job in that way. That to be able to know that, yeah, they're helping somebody, but that somebody else also understands them too is a pretty big deal.
Right. And our coworker and friend, Paul Miller, says, you don't have to be well to work, but you have to work to be well.
Uh-huh.
And so we have that sign up at Sunrise.
That's
And, it's true. You want to be able to work in that. Everybody wants to have meaning and to know that they can. And employment helps with that.
Employment is one of it's one of my favorite corners of my heart, and I will never not be a Miller employment girl. Just because it gives you such a sense of purpose. And even if you're not doing it for the income, which kind of sounds a little flippant out of context, I realize. But if you're a person who's been struggling and is part of any of our programs, struggling to find purpose or to connect with people or to get out of a hole that you've been in, and you can get to work no matter how minimally,
yep.
and you can connect with people, you can get out of your home, you can find something to do with any part of your
Yeah,
day,
the sense of purpose.
any kind of purpose at all. Work is so important because it can give you routine and structure
Right.
and new friends and a change of environment, and build something into your day that you can look forward to.
Mm-hmm.
It is so important, even if it's not going to be your main source of income.
Mm-hmm.
So valuable, so valuable.
So what can
And what
I want to
can you
know. I want to know what we can do to help support Sunrise, and what is it that we can do if we're not doing fundraisers and things like that right now.
So we'll have
What can
one
we
coming-
do to?
We are going to do a fundraiser,
Hopeful-
and it's going to be different this year.
Yeah,
Okay.
Hopefully, if all goes well.
So we are planning a fundraiser that was fairly successful the last time we did it with the PTO, because PTO moms
Yeah.
together for many, many moons, where we sold Red Sox tickets.
Oh.
And a portion of those ticket sales came to us, and so we're going to be doing that for Sunrise this year.
Nice.
And
Nice.
so where's the trip?
So, if all goes well, we're actually planning on going to New York City.
Wow.
So-
When the
it's-
air clears up.
Yes,
Right.
when the air clears. How we choose is we do a little survey and let the participants of Sunrise pick where they would like to go. We
And
give
so
them some choices.
how many people are currently like on the list to maybe go on this trip?
Well, I don't have a number because it changes.
It will vary from.
It will change, based on how confident some people are
Yeah.
feeling, and
Yeah.
then also how well people are doing, how much money we have.
Yeah.
Will dictate where we can actually go,
Mm-hmm.
and how long we can actually stay. New York City isn't an inexpensive place to
No.
visit,
No, definitely not.
so we, there's a lot of factors into it, and depending on how much money we raise, will
And how about
determine
volunteers? Do you have volunteers that help out in your service?
that. Sort of, yes. So we are a mental health agency, and so we do have certain rules around volunteering. So we do accept volunteers, but again, there are some rules around them. They have to, sign some agreements, go through some training, and
Right.
things like that.
Which is perfectly acceptable.
Yes.
That's what happens with a lot of people require that background check, even fingerprinting.
Yes.
You have to get
There are all kinds of different.
fingerprinted for the PTO now
Yes.
these days.
Right, there's all kinds of things like that is not out of the ordinary at all,
Yeah.
or a big ask. Really, it's all quite simple to
Yes.
do,
Yep.
and worth it. If you can give back a little, the
Right.
chances are if you're giving a little, you're going to get back a lot, and you just don't know it yet.
Exactly.
Yeah, that's the way I always look at it.
Yeah.
Anyways, I don't know.
What goes around comes around.
It does,
That doesn't
and-
always mean a bad thing.
Right, and it's exactly it's a pretty big deal to be able to do something like that, and I think especially in what you provide, just to be able to be somebody that some sort of a support person or peer support, or even just somebody hanging out down there and helping somebody on the computer fill out an application or
Exactly.
do anything like that. I mean, you could do that on your lunch break, and everybody could gain from that.
Yeah.
So it's just pretty awesome.
Yeah.
Yeah.
And so when we finalized game dates for ticket sales, you will be the first one to know.
Well, I hope
We'll
so.
be pushing tickets both
Yes.
inside the agency and out.
Yes.
Yes.
So, yeah, thanks for that offer.
Well, absolutely.
Yeah.
Yeah.
And anything else you wanted to highlight around what all the other programs that you're?
We just
Doing?
do so much. And the
Okay.
You
peers.
do do a
stuff.
lot.
Yeah,
Yeah.
so the peers within the agency, so proud of the work that is done. There's a peer-run crisis bed. The support team, there's a medication education and oversight program. We call it the assist team. There is the support team. We have a transitional room where people who are transitioning from maybe unhoused to house or from one housing situation to another, we have 2 beds. We will provide education support out in the community if people want to learn about some mental health symptoms and management and how to help with that, how to interact with people. We just, anything that's needed, the peers are so open to helping out, which is probably their greatest superpower without them realizing it. And so, yeah, anything that's needed it's done.
That's awesome.
Like I literally asked Penny the day before yesterday if she would come here with me, and here she is. So
Right.
jumps
Like,
at a
okay.
moment's notice.
Right.
Also, just last week you were helping people pack and
Yeah.
move out of the hotels.
Yes, so we helped last week. We'll be helping again next week. And then for the other 2 future dates, we also have some people that are going out to the campsites to help. We are making some food packets out for people, and they're delivering them and,
And that's
checking in on
been
them.
a huge talk and transition for many, the community and as well as the people needing those services and that are now unhoused.
Correct.
It's,
And as
Yeah.
I said, Sunrise, we have a shower. You need a shower, come on over.
that's pretty awesome, and I'm sure not a lot of places are offering that at the moment.
There's not a lot of places that have them available
Yeah.
either, but yeah, we're part of the community and we need to help each other out.
And let's tell people where you're located.
We are at 34 Berry Street on the Downing Street side of the building in Montpelier.
In Montpelier. Yeah. And how can they reach you?
Dropping on in is good, or, oh my goodness, you're going to ask a phone number. 223-7544 is this phone number to Sunrise.
Okay. Perfect. And do you want to share any phone numbers with us or anything?
I mean,
before we go, we wanna totally
Yes.
hype up this
So
the
229
hotline.
229-0591 is our 24/7 phone number. If you're looking for services during business hours, that's the line to call, whether you're looking for children or adults for any service at all. That is also our after hours emergency crisis line. If you're looking for a screener, that's the number to call.
Right, 24 hours a day, 7 days a week. That's the
That is
number
our
that's
number.
there for you.
Yeah.
And I've been handing it out like crazy. As you know, I've been posting it along with a long list of numbers that people can call right now. We've got a lot going on in the community. And
have.
so getting people connected with services so that they feel like they're not alone it's huge. It's
It is.
important. And, no matter where you stand with opinions about what is currently happening, what we can all agree on is that we want people to at least be able to get connected to services.
Right, because what is true is that it is happening.
Right.
Right.
Exactly.
And
It's
if you
it's
need
definitely
help,
not a
you
secret.
should know where to go for it.
Yeah. Yeah.
Um,
And it's
so-
not happening just today. That's the thing
Right.
I want to say too,
Right.
is that this isn't something that's happening just today. It didn't just occur. This is something that you all deal with on a daily basis and always have dealt with on
Right.
a daily basis, is
Right.
homelessness and mental health needs and
This
people
is always a thing. and
it's
it will
always a
be
thing.
a thing.
Right.
This is not
And
new,
so-
and it's never going to go
and the
away.
more that we all understand that, the better we're going to be.
Right.
If we understand that homelessness comes from many things, it could be mental
Exactly.
health, drug addiction, abuses. It could be domestic stuff.
It could be one short paycheck.
So yes,
Could be one
exactly,
short
It could be one short paycheck.
exactly. It
COVID.
could be so
And
many
it causes
things.
many other things potentially.
So I
just
met
don't know.
I met an elderly lady who sold her home because she could no longer care for it all by herself. She's
Mm-hmm.
older, and she thought she was going to get an apartment. That was like her plan, was
that
that she
makes
would
sense.
sell it and she would get an apartment to
Right.
downsize. Then there was no apartments and her house already sold.
Mm.
She was fixed income and instantly homeless. And so she's been living in one of the hotels now for the last a little over a year. And there's no place for her to go. And, she was able to get a little bit of an extension. But the cost of a hotel room per night is definitely not feasible for anybody not in this program. So, thankfully, I was able to help her, and she's going to be good. She's going to be in a good spot, but that's not the case for everyone.
Right.
But frightening to know that we have when people think of homelessness, they don't think of people like that.
No.
They don't think of elderly people. They don't think of the children or the
Families.
veterans or
Many people
the
assume
people
the
that
worst.
Exactly.
And it's unfortunate that happened.
some people, working moms and dads that just simply cannot afford to do it.
But
Right.
even if
It's
you can,
hard.
you can't find a place to do it.
Exactly. There's no housing.
Exactly.
I think
There
the larger
isn't.
problem that people are not seeing is that you cannot find a place.
Mm-hmm. Right. Right. There isn't a place.
There is
And
not
so
yeah.
and there's a lot of adapting and adjusting that we all need to do, and it's going to take a little bit. This is it's a lot for all of us to
yeah.
kind of like take all in and say, okay, it's a lot.
It's
I
a
mean,
lot.
there's a lot of fear. We've dealt with it in the city for the last couple of weeks. A lot of fear will people be camping in the parks? Will people be camping in the cemeteries? Will people be camping, in close to the schools or here or there? It's frightening, and to a lot of people, and including myself. I'm not going to lie. When I
Including the unhoused.
yeah, when exactly so I understand like that it's it literally is a crisis because it's affecting all of us. It's
Right.
affecting all of us in many different ways. And just I don't envy you all trying to figure this out and
And if you don't know what to
It's-
do with how you're feeling about all that, and it's causing you massive stress and anxiety,
Right.
and any other kind of feeling that you can't deal with on your
you
own, then
call,
you need to be
reach out,
calling that
right?
phone
Reach
number,
out whether
229-0591,
you're somebody in that
and talk to
situation
somebody
or
about
you're
it.
somebody afraid of what's happening in that
Yeah,
situation.
or you're seeing somebody else struggling with it.
right,
Have maybe suggest that they call,
right.
because you
Have
can't
the
do it for them if they're
compassion
over
to
18.
say, here's a number. I can't help you, but here's a number, and I
Would you
know
like me to
that.
help you call.
Right.
Yeah,
Yeah. That's a really big deal. And
definitely.
so again, the number is 802-229-0591, 24
Yes.
hours a day, 7 days a week.
Absolutely.
And call and,
Yes.
and reach out. And then if it's not a crisis and somebody just wants to talk to you about what you all offer for services, what number would you call?
The same number, because then they can tell you who to ask for when you do
Right.
call during business hours.
Perfect.
One other thing I want to mention, just in case anybody, I can't imagine this, is not following our Facebook page or, looking at our website on a regular basis, or yours. Gosh, I can't even imagine.
I know.
So the Valley Players out of Waitsfield have a run coming up of Willy Wonka, which is going to be an amazing show.
Oh.
And on July 9th, they're doing a, wait for it, sensory-friendly version.
Oh, nice.
Yeah. So I just want to get the word out there.
Of Willy
A
Wonka?
sensory-friendly
Are we like
version
gonna pull
of Willy Wonka.
taffy or something?
So, gosh, I wish. I would love taffy right now. So it's the lights will be dimmer, the noise will be a little quieter. People who need a sensory-friendly environment to experience this, which is not an opportunity that comes around in this area or
Right.
anywhere very often. I'm super psyched for it for my own 3 autistic kids.
Mm-hmm.
This is the show to go to, man. So you can go to the Valley Players. I'm going to get the website wrong. I'm going to send it to you so you can put it up so I don't screw it up.
Okay, and where is this located again?
In Waitsfield.
In Waitsfield.
So there will be a tent outside where people can go to take breaks if they need them to get away from
Mhm.
being in there.
Mm-hmm.
So you're encouraged to bring any kind of sensory equipment you might need for yourself. So if you normally need headphones in a place like this, or a fidget item, or chewy tubes or anything like that, bring it. If you have an AAC communication device,
Mm-hmm.
feel free to bring it. Bring whatever you need to be comfortable in any kind of environment. But we will also have some sensory things out in the tent. Well, they will, not we.
Mm-hmm.
It's not my gig, but I am so happy to help promote it. It is partially being supported by Washington County Mental Health Services. Other people are also supporting this. So that one show, July 9th, will be a sensory-friendly experience.
Nice.
And we've got some local stars in there. So Cassandra Damaris and her son Zane Damaris, who is a Berrytown middle and elementary school student. And then there are several Harwood students that are in this show and a few other local peeps. And it's just going to be a fantastic show. I can't wait to go. But I'm
It sounds
so,
great.
so excited for this sensory-friendly show.
That is awesome.
So I know, I'm so excited. So I'm going to send you all of the information so that you can get it posted.
Absolutely.
But I just wanted to just scream about it for 1 second.
Yeah, absolutely.
So that people would know that it was coming and get it out there on people's radar.
Yeah, that's great.
Because, oh, my heart is just so
Mm-hmm.
happy about this experience coming around, because it's not something that happens And if anybody wants to help support that show, then once the information's out there, they should definitely go to the website and reach out to the Valley Players
Nice.
so that it can be as
Thank you,
affordable
Valley
as possible.
Players.
I
Yes,
know.
absolutely.
So it can be as affordable as possible for the families that need to access this.
Right.
And when I say families, I mean of kids and adults, anybody who needs a sensory
Right.
friendly
Right.
experience in
To-
that way. It's
to
not
be able to
just
go.
like for kids. It's
Right.
for, anybody with autism, anybody that needs a sensory friendly experience.
Hey, I love
know.
Willy Wonka.
I know, man. Well, and they have several shows, so go to any of them. But this sensory friendly gig is a big deal around here. This does not happen.
No, it
So-
doesn't. Pretty cool.
So
Pretty cool.
excited.
Pretty cool.
So, yeah.
Anything else?
We were very excited to have just celebrated Gary Gordon, our,
30 years.
his 30 years of
30 years.
Screening
Nice.
with Washington County Mental
Hard
Health
job.
Center.
And that's a tough job.
That is.
Screening
And
is
he
that's no
he
joke,
is the
that
real
job.
deal, man.
Mm-hmm.
That dude is something else. So,
Yeah. That, well, congratulations.
it was so
Because
fun.
that's huge.
It is.
Yeah.
That's a long time to be doing that job and
Mm-hmm.
still have your head on straight.
Yep. Very hard
You
job.
see a lot of stuff in that role,
Mm-hmm.
man.
Yeah, you do. Yeah, you do. I mean, you all see a lot of stuff
But
in all your roles. You really do. And
Yeah.
again, we're fortunate to have this here in our community because not a lot of communities can say that they have the amount of supports as we all have. And we're very fortunate. We don't always realize it, but we are. And we thank y'all. Yeah. And thank you for
because
being
you guys all support us very
presenting
well.
sponsor of the Aired Out podcast, which we absolutely love. We love teaming up with you guys, working with you all, and it's a big deal to be able to bring the information to the community, let them know who's there for them, and that is what the big deal for JD and I both is to make that connection with all things Washington County. And so, yeah,
Without
we appreciate you.
guys, people probably wouldn't realize half of what we do, and then they wouldn't be able to take advantage of any of it. So
Yeah.
we appreciate you.
Well, we love shouting it out, and thank you so much for coming. Even though you didn't really care to sit over there on that hot seat.
No.
No, but you did it, and you did great. And thank you so much for coming. And I hope that it wasn't that scary, and now you'll want to come back again and join us for,
Yeah.
when you get closer to the.
Heather says yes.
Yes. Oh,
Yes.
so
Heather
yes,
says yes.
definitely you'll be back, and I would love to have you on my upcoming show. I'm going to be doing a podcast of my own called "It's No Secret." It's going to start on June 13th and at noon, and
Nice.
we are going to discuss everything drug addiction, mental health, which I mean hand in hand right there. And would love to have you come and talk about some
Have
of the
some-
resources that you have for the community, which
Yes.
I know that Washington County Mental Health also has a lot of resources when it comes to addiction and recovery and supports. And so I'd love to tie that back in with what I'm going to do on
Yeah.
Tuesdays as
That
well.
sounds
And
awesome.
yeah. So thank
start
you
making a
all for coming back and joining us this afternoon. And I hope you'll tune in tomorrow morning, 9:00 to Shits and Giggles when, I do my best to torment JD as always. So have a great day, everyone, and we'll see you in the morning.